Good evening to you, Professor. Those numbers have just come out. What are they telling you about the trajectory of this virus?
Good evening, Sally, and good evening to all of the viewers. I have to say, very worrying, very worrying. When you look at the first and second waves in Gauteng, the numbers peaked in the region of around 50 per 100,000 cases now per population. Now, when we're looking at the current wave, we are now far exceeding anything that Gauteng saw in the first and second waves. And it's hard to fully appreciate why that's the case, but it probably relates to a combination of things. First being the level of movement of people, because that's a critical variable. The more people move around, the more the virus has a chance to spread. And the second is the amount of time people are spending indoors. And it's winter and it's cold and people want to get in to indoors and lock the windows, so that's probably contributing. And the third is the level of immunity seems to be at a lower point than we would have thought applicable to this particular situation. Now, we know that it's not an issue relating to the variant, because the third wave in Gauteng is the same variant we saw in the second wave, and so we would have expected it to behave similarly to what we saw in the second wave, but in Gauteng it seems to be much worse this time round.
Of course, the big question is, what about restrictions? We've heard the Premier saying he's going to be calling for new restrictions, but of course he's saying as well that we can't do another full shutdown. We just economically cannot afford that, talking about possibly suggesting a hybrid of levels 3 and levels 4. Other people we speak to say, look, it's actually too late. Our hospitals are overflowing and we've just got to hunker down and get through as best we can. What advice would you give on restrictions, if it were up to you?
So when you're looking at any situation in COVID-19 cases, you have to look at it in relation to infections that have already occurred that will become apparent in the next 7 to 14 days. Because what you're seeing, when you're seeing today, let's say 9,000 cases, those infections actually occurred somewhere between a week and 2 weeks ago. So the epidemic already has a momentum and is growing at this rapid rate. So if you want to try and slow it down, you've got to take quite drastic action because of the high level of new infections. So that will mean substantial restrictions would need to be put in place. Now, to some extent, those who say that it's too late are right, that we cannot really avert much of the peak of infections in Gauteng with restrictions being implemented now. If we wanted that, we should have done that 2 or 3 weeks ago when it would have been more appropriate. But in one sense, they're not accurate, and that is that there is implementing restrictions now would assist in speeding up the recovery rate and the rate at which the cases will decline on the downward part of the slope. So there is a significant benefit to implementing restrictions, even though it might not avert the peak. What kinds of restrictions? I would say that a lot of indoor activity would need to be seriously reconsidered. Having any indoor activity with more than, say 10 people is going to be, a risky situation. I would also say that all, non-essential travel should be, put off at least for the next 2 weeks or so, just to see this period through. So things like indoor dining, which carry a very high risk, those are the kinds of things you want to avert.
All right, so what I'm hearing you saying is that if we're going to try and do anything to at least make things slightly easier in the next 3 to 4 weeks, we have to probably shut our restaurants right now here in Gauteng. stop leisure travel in and out of the province, and shut down any gatherings over 10 people. What about alcohol?
I think the alcohol situation is probably a bit too late to do something now. We should have actually dealt with alcohol a little while ago, in that you really have to act on alcohol in order to clear the hospitals. So if we're going to act on alcohol now, we'll probably only see the benefits in about a week or two from now. And by then, the benefits would be marginal. But in my view, because the cases will probably still be quite high, yes, there is a benefit to increasing the alcohol restrictions. The higher priority for me is to ensure that all the indoor activities, especially indoor activities where people do not have masks, those should really be stopped and curtailed as a matter of urgency. So that would be bars, taverns, restaurants, but allowing them to have outdoor activities. Just, we're not talking about closing restaurants, but just closing the indoor dining component of all restaurants.
What do you feel about schools? We know that schools research shows us they're not massive sites for spreading, but in this time of crisis, particularly here in Gauteng, any gathering carries with it a risk. Do you think we should look at a temporary closure of our schools until we're through the worst, 2 or 3 weeks perhaps?
There's a very good analysis in a paper published in Science which looked at something like about 200 odd countries and analyzed the impact of various different interventions. And the highest impact intervention is a reduction in gatherings. So that's the number one intervention that you can make to actually slow the rate of infections, what we call the R0. But the third item on that list is schools. And schools pose a particular risk in relation to teachers passing infections to children, and children then passing it to families. And because the current variant, the beta variant, has a high secondary attack rate, and doctors describe it anecdotally that if you just have one person in a family, very soon you're going to see all the other members of the family as well because of its high attack rate at home. So if you're intervening with schools, you can have that kind of impact. Now, in our situation, what we have in place are procedures and regulations, or these protocols, in order to keep children at lower risk in the school situation. And if a school has good protocols in place, then I'm not supportive of closing schools. But I think where you have a situation where protocols are not being observed or can't be observed because of overcrowding, then there is a good case to be made. And they only need to close for a short period, because this peak is going to be reached within the next week or so. And within the next 2 weeks, we will be on the downward side of the curve. So just a short intervention in schools that can't follow protocols.
Prof, I have to ask you a question that is political in nature, and I ask it because it is so crucial that we learn from mistakes made. Last night, your successor, Professor Koleka Mlisana, told my colleague Shahan Ramkisoon that Gauteng did not prepare properly. Do you agree with her?
It's a bit difficult for me to say. I don't keep abreast of what's going on the ground in the provinces. It's just beyond my ability. But, it was an issue I raised. Actually, I think I raised it with you on the 27th of May. So that's almost, 3-4 weeks ago, where I said, a high priority is to ensure that our health services are prepared. And I gave 3 things that they need to do. And one of those was to ensure that they have enough beds. And so that means, curtailing elective surgery and so on. And the others, one of the other points I made was that it's important that they have field hospitals, because you need some mechanism to take away the not so sick out of the hospitals, to let the hospitals focus on the really sick patients. So if Gauteng hasn't done those elementary things, then in my view they haven't prepared. I don't know if they've done or not done those things, because I'm not actively involved on the ground and don't keep abreast at that level.
Well, thank you very much for your time this evening. We do appreciate it. That was Professor Salim Abdul Karim, member of the World Health Organization Science Panel. He's also head of CAPRISA, the Center for the AIDS Program in South Africa. And on the issue of restrictions, he's saying he partially agrees that in a way for Gauteng it's a little bit too late. But if we did want to do anything, we'd have to take fairly drastic action. One of those, controlling travel in and out of the province. Essentially, we're moving around too much in and around Gauteng.